Hello and welcome to the big picture. The importance of the flagship programs aimed at the common man is what brought the UPA back to power, or at least that's what the general belief is. In the run-up to the presentation of the latest budget presented yesterday by Finance Minister P. Chidambaram, much had been written and discussed about how he would deal with these programs. Many were of the view that he would give a big impetus to these programs, considering this is the last full-fledged budget before the UPA's term ends next year. Chidambaram, however, surprised many by containing the allocations to most of these programs in his drive towards austerity. Even his announcement that he has set aside 10,000 crores for food security has been taken with skepticism. The meager 13.9% hike for health has disappointed many, and even the health minister expressed his helplessness when asked about the fate of universal health coverage. Why has the finance minister preferred to virtually keep the flagship program allocations almost stagnant? Have all these programs reached a stage where they don't need more allocations? Or is the confidence reposed by the finance minister about direct cash benefit transfer the reason behind it? We will discuss all this today with Shailaja Chandra, former Secretary Health in the Government of India, Professor Ravi, Srivastava, Center for the Study of Regional Development in the JNU, Vipul Mudgal of Inclusive Media for Change at the CSDS, and Biraj Patnaik, Principal Advisor to the Supreme Court Commissioners on Right to Food. Welcome to all of you. Biraj, actually I would like to come to you first. There is this feeling as we go through the small print of the budget.
Yes.
Why has he done this? Why has he, contained these allocations? I was having a look at the Manrega expenditures in the last, 6 years. It from 2007 it went up. It reached a peak in 2010-11, and now it is coming down.
Absolutely.
So does it mean that, as far as Manrega is concerned, it has reached a stage where more allocations are not necessary, because he has not given even a single paise more than the last year's allocation?
Now let me explain what he's actually done. It goes deeper. The first thing that the finance minister did was, before the, it's like what the railway minister did. You increase ticket prices way before the budget. So when the budget comes, you say we are not increasing prices. Now this was done by the finance minister by pressurizing all social sector program ministries to cut down and reduce the RE, or what is the revised expenditure.
Right.
So the first thing you will notice, Girish, if you go back from the current budget to the revised estimates, if you look at the revised estimates, the RE is much lower for the social sector. Traditionally in the social sectors, the RE is always higher than the BE.
Yes.
But this is year.
Except in one
Yes,
of those schemes.
exactly.
I think
Except in one of those
up.
schemes, universally it's higher.
Yes.
But what he has done is, first he arm-twisted ministries by not releasing funds. And then in his budget speech, he very cleverly compared the increase that was happening in various programs with the RE rather than the BE, which was higher. So it looked like a tremendous jump. Now let me just give you the example of
we are not going.
yeah?
We are not going by the spin of the finance
Absolutely.
minister. We are going by what the numbers are.
Absolutely.
And according to the numbers, almost all the schemes, most of the schemes have had lesser allocations.
In fact, they're even lesser if you look at the rate of inflation. If you look at the rate of inflation, if you are increasing a food scheme, for instance, in 30 years you have the highest food inflation.
No,
if you take the midday meal,
okay. But my question,
it's actually much worse.
My question to you is, does it mean that if we stick to Manrega for the present, does it mean that Manrega has reached a stage where it doesn't need more allocations?
No, that's not true. But what you have done is, by insisting, say for instance, on bank transfers, by not having adequate technical staff on the ground, there is a demand. People want work. In fact, I was in a day-long meeting in the Planning Commission where people from some of the poorest districts had come, and their demand applications are not being met. In just 415 families of the poorest communities in Bihar, the Musahars, you've had a 40 lakh payment which has not been made on Narega wages for the last 2 years. So there is a demand, people want work. This program is a great scope for expansion. It is saturated in terms of the government's political will to take this program.
Which is a very interesting and interesting thing. Professor Ravi Srivastava, you think that you agree with what he says, or do you see that finance minister's assertions even on that budget day yesterday was that if you need more money I will give, but he has maintained like 33,000 crores last year for Manrega, same 33,000 crores this year.
You see, I mean,
I will come to the other schemes,
As Biraj is absolutely...
In fact, Prime Minister Gram Sadak Yojana it has come down from 24,000 crores to 21,700 crores.
You know, as Biraj has very rightly said, the process of fiscal tightening began 6 months ago, along with some other policy measures.
Right.
And ministers have been protesting, ministries have been protesting all along. Of course, the Rural Development Minister protested very, very vocally on the cuts that have happened.
Yes.
Now, once you actually introduce this process of cuts, in addition to the implementation problems that are there at the ground level, which of course, you know, add to the absorption problems and so on within individual states, what happens is that people turn away from schemes. You know, for instance, delays in payments in Manrega, which is what he has referred to, or in fact, just not starting public works. Because this is, you know, Manrega should be a demand-led scheme. But on the ground, the signals go down that we are willing, you know, the state, the panchayat will say, now we have the money, now we have the resources to start a public work in our area. So please come in, work, please come in or apply. Now, if actually that doesn't happen, people just turn away. And this is what I've seen on the ground. In state after state, basically what has happened is that the fiscal constraints have actually made the scheme very, very thin on the ground over the last few months and years.
Right.
So this is basically what is happening. If you choke the pipelines in one way or another, then at the end of the day, you will say it's implementation problems, it's absorption problems, we are willing to give funds, but people are not coming forth. And this is what has happened to Manrega.
That's
there is demand for Manrega. We need not compare it with 2010, 11, or you know, there could be drought years and non-drought years, but nonetheless, there is demand for Manrega, which is not being realized on the ground for various reasons.
Okay. Vipul, isn't it very interesting that this is the scheme, Manrega, we will come to the other scheme. Manrega was the scheme which popularly everybody thought is what brought back the UPA to power in 2009. Now, this kind of attitude, do you find this, you know, how do you
I think they are moving away. I think they are moving away from Manrega already, and they have made up their mind to move towards direct cash transfer.
Yes.
Now there is it's a problem being realized everywhere. I'll come to that point, but let me say something about the philosophy of the budget.
Right.
We are talking about inclusive development.
Right.
We have a very good social sector in this country. We have NGOs, we have very good intermediaries, we have think tanks, we have people who are working on the ground, SHGs, all kinds of institutions are there. If the finance minister really wanted to work in the social sector, he could have involved these people.
Right.
You know, budget needs inclusive consultation.
Absolutely.
Inclusive deliberation also, which should have started not a month before, but at least 6 months earlier.
Right.
In October, September, they should have started those consultations, and they would have come to the conclusion that all these schemes will not work because they have a design fault, because the community, the panchayat system is not being involved. And I think that there's a serious flaw there. And I think until that is done, the more tendency towards centralization, every scheme is centralized. And I saw no provision in the budget for capacity building or taking these schemes to people in any significant way. So I think that is where it is self-defeating in many ways. And for Narega, I mean, you can say everything is good about Narega. I mean, it has brought you out of the recession. It has brought financial inclusion to the tune of 12 crore new bank accounts, post offices or banks.
It is what we call an automatic stabilizer.
Equal wages for men and women. It has brought the floor rate up. So I mean to say that...
And the purchasing power in rural areas has gone up because of this.
And the wages are also going up.
Wages has gone up.
So I think in that sense, to run down Manrega would be a mistake.
It's a mistake. Ms. Shailaja Chandra, you have been in the government. You know, one issue, we will come to the, you know, your specialization about health and things, but one issue which Vipul raised is about consultations. These consultations, you have been in the government, these consultations happen more often when before the budget we read a lot about consultation with the industry, with, you know, with all those. But we don't hear much about consultations with the social sector, people who are involved in the social sector. Is there some kind of a resistance to that, or what is the problem there?
You know, I'd like to share with you something which all of you will turn around and say, why didn't you do something when you were yourself in the ministry? I know that. But